Bring your laptop. Hi guys, good morning. This is Dr. Behnam. Welcome to another AMA session with Dr. Ben. Um, Sorry, we're having a little bit of difficulty. Uh, Somebody said love Happy Head. Well, thank you. Welcome, Dr. Behnam. I'm one of the founders of Happy Head and the chief medical officer. So today we are going to be talking about basically how much shedding is normal. So this is a very commonly asked question. So typically when the Happy products has minoxidil in it. There are three components: minoxidil, finasteride, and retinoic acid. The component that actually causes the initial shedding is the minoxidil, and that's normal. Even the over-the-counter minoxidil, it says that you could shed a little bit, and that's normal. So typically, we say that typically the shedding happens about 5% of patients, 5 to 10%. It typically lasts about 6 to 8 weeks, and a lot of those patients by the 8th week, basically, they've already stopped shedding. And in like a lot of those cases, although people feel shedding, a lot of patients actually are still growing out hair. Now, if the shedding continues beyond the 8th week, we typically tell the patient actually to stop. So it's really the 8th week mark, that really want to make sure that the 8 to 10 weeks that patient, the kind of the shedding stopping. Now, if you guys have any questions, feel free to send us an email at help@happyed, and we'll be more than happy to evaluate your case each case at a time. So how soon can I wet my hair after applying Happy Head? So basically, you can literally wash out the product about an hour to 2 hours after you apply Happy Head on. I heard that some people take oral finasteride every other day, every third day, or even 3 times per week. Can you comment on this? Most people would want to take the lowest effective dosage. What is your experience with dosing? So that's a very good question. First of all, you have to realize that although there are a lot of different ways of doing it, there's really no right or wrong answer. And the reason is because everyone's body is different. So it's possible that if I would take oral finasteride, I might respond really well to 3 days a week, whereas if you were to take it, you're not going to respond at all to 3 days a week. You might need to do it every day. So everyone's different, and you really have to kind of play around with it. But typically, we say that for best results, the first 6 months you should do it every day. After that, you can basically titrate down to maybe 3 to 4 times a week, and see how you do. There are also some patients. Again, I'm not recommending this, but I'm just telling how some other people would do it. Would take oral finasteride 5 days a week and do finasteride 2 days a week. I don't understand how that regimen came from. Some people do it. They say it works for them. And I'm not recommending it, but I'm just saying there are many different ways of doing it. The most consistent way that I feel works the best is that if you're already doing topical finasteride or topical dutasteride, about 2 or 3 months into it, you could add the oral pill to it, and you will see better results. So let's say if you're doing topical finasteride for 3 months, then you add oral finasteride to the regimen, you're going to see better results as opposed to you doing one of them one at a time. Why does Happy require once a day for the first 1 week and then twice a day? That's a good question. It's because, so the idea of reducing side effects obviously that's a very important idea. But the way we achieve that is that we truly believe that if you titrate up slowly, you're going to have lower side effects. So in other words, basically not shocking your system is the key. So we have found out that in our practice, and I've been practicing for over 14, 15 years just doing hair stuff, that if patients that get the most amount of side effects by taking the oral finasteride, the ones that start taking the pills every day to begin with. But we came up with a different method a couple of years ago where instead of taking the pill once a day, you kind of titrate up slowly. So like week 1, you take on Monday, week 2, you do Monday, Friday, week 3, you do Monday, Wednesday, Friday. So you titrate up slowly. And we've noticed that patients that titrate up slowly under oral finasteride had lower risk of central side effects just because you didn't shock the system. The same thing goes basically with topical Happy Head. We don't want you to shock your system, so that first week doing it once a day basically kind of preps your body for it, and then you go to twice a day. So that's a very good question, but that's the logic behind that. And again, there's some patients that even don't won't even do the topical one day a week. The first week they would do it every other day, and then slowly touch it up to once a day, and then slowly touch it up to twice a day. So it depends upon your sensitivity, your medical history. Let's say you already took finasteride orally and had side effects, so you just want to ease into the topical finasteride. What happens if I need more than 1 ml to cover the affected area? So typically we say 1 ml is the max, unless you're doing it once a day. If you do once a day, you could do 1.5 ml. But I just feel that if you do more than 1 ml, you're more likely to expose your body to more finasteride, and you're more likely to have more side effects. So 1 ml twice a day is the recommended dose. Can I use Happy after expiration date? How long beyond the use date? That's a very good question. So, so yes, so obviously the product is not going to stop working the day after it expires. So you could use it after the expiration date. Just legally, we have to put the expiration date on it. We don't obviously recommend waiting 6 months to use the product. So the sooner you finish after expiration, the better it is. You have said that if one is completely bald, then Happy Head or any other company similar to it is not able to help. I assume this applies to those areas of one's head where the hair has been lost for a long time and there is no visible hair, even though one might be able to get results from Happy in other areas of the scalp. Is that correct? Yes. So let's say I am bald, complete bald in my crown area, and thinned out in the front. When you apply Happy to the scalp, front and back included, you should grow hair, you should grow thicker on the front, but the back is not going to help you. Now, obviously, if you put it in the front, it's not going to hurt for you to rub it on the back. So that's all fine. You could do it. I don't think you're going to see much results, but you are correct. But the answer is correct. Hello, I'm from Connecticut. Hi, Dr. Behnam from LA. Question: how much shedding can I experience? 43-year-old male, been losing hair for about 6 to 7 years. Still have some hair left on my head. Does it mean that I will lose all my current hair and become bald, or is it just some shedding? So great question. It's only some shedding. So it's just a little bit amount of hair loss. It's not. I mean, it should not be significant amount of hair loss. You should not go bald from the initial shedding. So the initial shedding is actually normal on minoxidil, both prescription and over the counter. It should not be significant. Now, obviously, if you're 3-4 months into Happy and you're still significantly losing hair, then you should stop the medication. But that's very rare. That is very rare. But that's a very good question. Thinning after months of treatment, what does it mean? So obviously, if you're using it for 5 months and you continue to thin out, it means two things. One, you're probably just shedding from the product, but that's unlikely. Two, the more likely answer is that your body's continuing to shed and is not really responding to the product. So another thing would be to do is to go on the oral medication. So you have topical finasteride, I will add oral finasteride. And we do have oral finasteride. It's not listed on our website, but we do have it. Just contact help at Happy Head. And then two, we could also switch out your topical finasteride to topical dutasteride and see if you get better results. But again, reach out to us and we could actually customize your game plan for you. So guys, we're here to take care of you. So just reach out to help at Happy Head. Say, look, I'm not responding. It's been 4 months. What do I do next? And we'll give you all the options. What is the medicine different for women? So for females, it really depends upon your age. So if you're above the age of 50, you could use finasteride both topically as well as orally. If you're below the age of 50, we do not dispense finasteride to females below the age of 50 because of the risk of getting pregnant, and finasteride is a category X. I get this email all the time saying that there are other companies that do it. We feel as a company that we have a social and ethical responsibility to our patients, and we don't want to put our patients at risk or at harm. So we made this stance very early on that if you're female below age 50, we don't want you to take finasteride. But there are other pills. There's spironolactone. Spironolactone can be done both orally and topically, and it could help you. Now, even with spironolactone, you should not use the product if you're going to get pregnant. However, it is not a category X, what we call a category D. So, but again, you should still not get pregnant on spironolactone either. Thank you so much for that question. What do I do about the smell of spironolactone? That's a very good question. Uh, Topical spironolactone smells bad. I admit it. We have tried very hard to mask that smell, and we currently am adding peppermint to it. And it helps, but it is not perfect. I don't think there's much you could do. I know there's some patients that would wash the product out after an hour or two, which is fine. The product's still gonna work, but you can wash it out. There's some people that apply lavender oil on it, to make it smell better. That's another idea. But unfortunately, we really have tried very hard, but we cannot get rid of that smell completely. Any progress on happy at getting laser light therapy? Thank you so much for that question. We literally talk about that almost every other day. With the laser light therapy, um, one of the most important things is that trying to get the correct device. You see, there are a lot of devices out there, but it doesn't mean that it's out there that we're necessarily gonna use it. We are trying to come up with our own device that we know is gonna work better than other ones. So it really depends on the type of LED you have, the position of the LED in the laser, the number of LED it has, and how snug it is on your head. So there are a lot of different factors, and we are currently evaluating all those factors and looking at the clinical studies and seeing which combination of all these things will come together to give patients the best results. So we're still currently working on it. Can you explain how hair growth cycle work? How does the treatment work? So very good question. So happy head. Um, so basically, with the happy head, there's three ingredients in the formula. There's finasteride, minoxidil, and retinoic acid. The reason why the product like happy head or any other product doesn't work right away is because your body has to go through couple hair cycles for it to start basically growing out. That's why it takes about 4 to 6 months for it to work. Now, given the fact that there are multiple ingredients in the product, means that the mechanism of action of these ingredients are different, and it's the synergistic effect of all these ingredients that's going to give patients the best results. So, for example, minoxidil is a vasodilator, increases blood flow to the hair and washes out basically the old DHT, and also increases the oxygen level basically where the hair is, and that by itself inversely reduces the DHT. So that increased blood flow will not happen overnight. It will take some time for it to happen. Number two, finasteride is a testosterone blocker, and by blocking testosterone, it basically blocks your DHT. So again, that's not going to happen overnight. But when you have the finasteride, the testosterone blocker, and the vasodilator together, you're synergistically going to get better results, but you still need to wait several hair cycles for that to work. Will a person who has been minoxidil already experience motion shedding? Typically not. Hi, Dr. Ben. There are a few other things that I have related to the new water-based formula. So with this one in particular, it's regarding my experiences so far with utilizing it. So I noticed that it leaves a tackier feel after massaging in, and it came with a stronger fragrance too upon first opening the product, as opposed to how the regular formula was. I wonder if any of that is normal. So yeah, so we have tested that water-based formula many, many, many times. Me personally, our VP of operations. Yes, so when we open the bottle, initially it has a slightly stronger smell, but not really afterwards. With respect to it leaving a tackier feel, the reason is because, so typically our old bottle had 50% propylene glycol and 50% ethanol alcohol. The new bottle is 80% basically just oils, and is only 20% alcohol, which is not propylene glycol. So we went from 100% alcohol to only 20% alcohol, but that 80% has been replaced basically with just different type of oils, like lavender oils and like basically things like that. And some of those oils has some natural fragrance and scent to it. So yes, you are correct, but hopefully you're still gonna like it. I mean, we really tried very hard to make it like a really good product. But 80% of the product now is just natural oils and could have some natural fragrance to it. Now, if you still, we still have a serum that you could apply on top of it. Um, but when you said, I mean, I don't think, I mean, as long as not really, our goal was to reduce the irritation, and I think we have kind of accomplished our goal. If you feel it's still a little attacker, we could still send your serum to apply a serum onto the scalp, so it basically smooths it out. But please let me know how that goes. Is there any propylene glycol in the water-based formula? No, there is no propylene glycol in the water-based formula, guys. Not at all. So it's 80% just oils, like lavender oil and other stuff, and then it's 20% another different type of alcohol, but there's no propylene glycol in it. I've heard about a new drug, which is JAK inhibitor. It has been all over the news that it helps with alopecia areata. Do you know if there's any news that will also help with male pattern baldness? No, it does not help with male pattern baldness at all, unfortunately. JAK inhibitors only help with alopecia areata, which is an autoimmune condition. I have alopecia areata, actually. I did just recently prescribe that drug for one of my patients. First of all, it's very difficult to get, and it's not going to help male pattern or female pattern hair loss. Can happy be used as a preventative to hair loss? What's the best age to start? Yes, it could be used as a preventative to hair loss. Look, I would probably be about 21 to 25 if I'm going to use it preventatively. Also, I wonder how come there's less tretinoin in this one compared with the regular solution. Yeah, so the water-based formula has a little bit less of retinoic acid, and the reason is because we want to reduce some of the irritation. So that's the whole purpose. So we lowered the retinoic acid to reduce the irritation, but we kept the minoxidil 8%, as well as the finasteride, basically the same concentration. Can it be too old for happy? I don't think age is a factor. It really all depends on um, basically the amount of density you have. So, I mean, if you're 30 years old and you're bald, happy head is not going to help you. If you're 80 years old and you're thinned out, happy head will help you. So it really depends upon the density and not necessarily um, uh, uh, on your age. Now, obviously, the younger the age you are, you're going to have better results. Uh, but it's more about the density. What causes hair graying? Honestly, we don't know, and unfortunately, we don't have the answer to it. Hi, I'm from Orange, California. I just received my fourth bottle, and it came with a sachet of Happy shampoo and conditioner. Is it available to purchase now? By the way, my hair is still growing, and I'm very happy. Thank you so much from my patient from Orange County. I'm excited. Well, I'm glad that you're getting great results. Yes, it is available. Just email help at Happy Head, and we'll be more than happy basically to have you basically that you purchase it. Our new website is about to go up in the next few weeks, and it's going to have a shopping cart where you're going to be able to buy stuff. I know a lot of our patients saying, how come the shopping cart is not on the website? Honestly, there's a lot that goes on the back, and you have to realize that we are a HIPAA compliant website, and a lot of stuff basically has to do with doctors and prescriptions. Your prescription gets basically written on a monthly basis, and it gets sent to the pharmacy. So a lot goes on the back end. So we need to make sure that everything is perfect, and that the shopping cart is not gonna interrupt our daily routine for our patients. So yeah, just email help at Happy Head, and we'll be more than happy to get you the shampoo and conditioner. I use the shampoo every night, guys, and the conditioner, and I love it. And my son uses it as well. My son uses the Happy Head shampoo. He's only 4 years old. I will take a video of him next time. But yes, we all use it in the family. What do I do about the flakiness and the irritation? But what is the best way to avoid it? So first of all, we have our new water-based formula, which has 80% less alcohol in it, has no propylene glycol, and the retinoic acid is less. But the key ingredients of finasteride and minoxidil are the same. So you could just basically reach out to us at Help at Happy It, and we'll be more than happy to set you to the water-based formula and see if that's going to help. Also, we have a special serum that we will send you, and the serum basically is going to help smooth out, and just it's very soothing. So that we could do as well. So just email us at Help at Happy It, and we'll be more than happy to help you. Oral minoxidil versus topical minoxidil, which is more effective and why? So the way that topical minoxidil was discovered was because oral minoxidil uh, could have more side effects of dizziness and lightheadedness, more risk of swelling, particularly ankle swelling, and it's a blood pressure medication, so it could basically alter your blood pressure more than topical minoxidil. But there was first oral minoxidil, and then people realized that, look, I can make this into a topical, so let's make this into a topical minoxidil formula. Now, there are some patients that actually we have on both oral and topical minoxidil. We have patients that don't want to take oral finasteride, and the topical happy head, they think they could see better results if they were to be on an oral medication as well. So they use topical habit for a few months, and then they go on oral minoxidil. The way it works is that we typically have patients titrate up. So you cut the pills into a quarter for about 2 weeks, then to a half for about 2 weeks, and then after that, basically you take a full tablet. You could also basically do a blood pressure medication. You could also take a blood pressure medication, a blood pressure cuff. I'm so sorry. I had a phone call coming in. A blood pressure cuff. And the blood pressure cuff, basically, you could also measure your blood pressure so you don't basically drop down your blood pressure as well. I do a lot of oral minoxidil in my office. I love it quite a bit. Just FYI, in more Middle Eastern individuals, particularly females, it could cause more hair growth everywhere. So just kind of watch out for that. But overall, it's very safe. I typically feel that female patients are very comfortable doing a half a tablet a day, and male patients do about a one full tablet a day. Again, we do offer it, so just reach out to Happy Head, and we'll be more than happy to put you on it. There are also some patients that are using topical Happy Head with oral finasteride and oral minoxidil. Remember, these are all customized. This is a customized plan, so it all depends on how you do. So if you basically go on, 5 months of happy and you're not seeing the results that you want, we can certainly add one of the oral medications for you. And everyone's different. So just reach out to us. Help at Happy Head. We'll be more than happy to guide you in the correct directions. Are there any drugs on the horizon that will help grow hair on bald scalp? Unfortunately, no. We really don't know basically anything else. But we do know that, again, two things. One, if you're bald, nothing is going to help you. You just need hair transplant, unfortunately. Two, if you're thinning, Happy Head is going to help you. And there's also oral medication like oral finasteride or dutasteride, oral minoxidil, and oral spironolactone that we could also add to the Happy Head regimen that could help you as well. Remember, everyone's different. And some patients may respond to oral medications and some patients may not. Some patients respond to topical happy and some patients may not. And sometimes you have to add both together. We definitely know that patients that are both on topical happy and oral finasteride or minoxidil and tend to get better results than being on one of those medications alone by themselves. So if you're on one of these medications alone and you're not seeing the results that you want to see, we could certainly add another synergistic medication so you get better results. Thank you for that question, by the way. Tips on applying the topical and derma rolling for long hair. Very good question. So if you have long hair, I would not use a derma roller. I would use a derma pen or a derma stamp. You can actually buy it on Amazon. There's derma stamps, basically it's a stamp that goes up and down as opposed to rolls back and forth. So apply happy on your scalp and just derma stamp it. Or get like one of those derma pens, which is the automatic derma stamp. If I want to order Happy Head from Connecticut, will I need to have one-on-one video meeting with Happy Head medical provider before they send it to me? I don't. Well, please reach out to help at Happy Head, and I would be more than happy to answer you. Obviously, there's certain states that need a live consultation, but you know what? Our system in the back end will automatically take care of it. So why don't you do the order, and basically, depending upon your state, it either basically kicks you to an asynchronous or a synchronous. The system is already built on the back end. I don't know on top of my head the laws about Connecticut, but the system knows on the back end. So just do it, and we'll be more than happy basically to take care of you. We definitely have patients in Connecticut that are using it, so we'll figure it out for you. Are you planning on having a chat option on your website outside of the live Q&A? maybe an FAQ available as well. So first of all, we do have an FAQ page, but Chad, we did talk about this. I will definitely bring this up to our engineering staff. Thank you so much for that question. I've tried the samples of the hair thickening shampoo and conditioner I can with my order, and I'm liking it so far. And I and like oh, and I like the fact that it's a subtle scent. Yes, so it does have a nice subtle citrusy scent to it. So I'm glad you like it. I'm glad you like it, Chris. Please send an email to us, and we'll be more than happy to get you started on that. I really appreciate it. Thank you so much. Again, email at help@happy.com. Again, a couple of things I want to go over. One is derma rolling. Again, we recommend applying the topical happy on top, gently roll basically back and forth. And again, that's going to help you quite a bit. For long hair, instead of getting a derma roller, you could get a derma stab. I think that's going to be easier. Derma rolling is done typically once a day at the 0.25 depth, whereas the topical happy is applied twice daily. With respect to, by the way, we welcome basically more comments and feedbacks on our shampoos and conditioners, and also the water-based formula. The water-based formula, we are very, very proud to have this, because this is a propylene glycol-free product. It has 80% less alcohol, which is less irritation, less flakiness, less redness. So if you're having any flakiness or anything, please let us know. Please also realize that a water-based formula has only a 30-day expiration date. You could use it beyond the expiration date, but we just want to let you know it is literally made when you order it. So imagine going to In-N-Out and they literally make it for you. We are literally at that stage where we have enough pharmacists on staff that they literally make it for you and ship it out to you. But the entire process will take a couple of days by the time you get it. So the question about derma roller, do I need to apply the solution first and then use derma roller, or vice versa? I've been using derma roller first, which is fine. Look, there's no right and wrong way of doing this. And I think in all of our actually instruction, it says derma roller first. But some people actually put the product in and try to derma roll afterwards. Again, there's no wrong or right way. You should try that actually and let me know which one works better for you. I recently had a hair transplant procedure. Does using your product make sense in case like mine? Absolutely. We actually have a lot of patients that do hair transplant in our office and end up using Happy product about a month or two after the transplant. We typically wait about 6 to 8 weeks before using it, though. So let the scalp heal up, and also make sure that the scalp is not red or any side effects from the transplant before using the Happy product. Why do I see different branding across the website and bottle? Is there new branding coming out? Yes. We hired a very famous branding company who rebranded our basically the entire Happy Head. And we are coming out with our new branding. We hope you like it. So the original branding, so I'm just want to take you a small step in history of Happy Head. The original branding and design basically was done with one of our own engineers years ago, when Happy Head was originally being launched, and we loved the orange. That's how everything was orange initially. And literally, me and Dr. Sean, the other co-founder, and my wife, actually, we all sat in our living room with our engineer, basically coming up with the branding of Happy Head. And we had that on our website for almost 2.5 years, but we're basically beginning to change it, make it a little modern, as we're always trying to update things. So the new branding will come out, and it should be official soon. But as you see right now, a lot of the new bottles and shampoos have the new branding on it. Where did the name Happy Head come from? Great question. So it took us almost 6 months to come up with that name. It was a lot of work basically between bouncing ideas off of Dr. Sean and actually my wife. And I came up with it basically honestly one day after 6 months of brainstorming and having many different names actually. The idea of Happy Head came from the fact that we kind of wanted to come up with the idea that not too serious. So we wanted to make hair loss something that is not a taboo, and people are more comfortable talking about it. So, and we wanted to make something that's a little more light and also that people kind of feel not funny, but kind of feel kind of like, oh, that's a funny thing, you know. So that's how we came up with that. That's kind of like making light of a very serious subject. So that's how we came up with it. A lot of the idea came with the fact that I was walking past by Happy Socks in at Century City Mall. I'm like, wow, Happy Socks. I love that name, you know. And initially it was Happy Hair at the beginning, but then we switched over to Happy Head. So that's how the name is. So it's, you know, so it's light. It's not too serious. It's funny, you know, and but it's not really making joke of the matter. So it's still serious, but it's, you know, but it's kind of fun. So that's how we came up with the name. Thank you for asking that question, by the way. You guys are asking a lot of questions of how the company originated about 2.5 years ago. But and Happy it did originate from our office, and a lot of the ideas basically and design came basically when my son was 1.5 years old, and we have my designer next to us in our living room.